Hi everyone. So today I'm going to talk to y'all to introduce my podcast. In my podcast, I'm going to be talking about ideas and topics that pertain to the scope of public health, and I am so excited to start this journey with y'all. So I thought it'd be best to start by introducing myself. I am a student from Texas, and one really important thing about me is that I have a stutter. So, what does it mean to have a stutter? Having a stutter means having a communication disorder that affects the flow and fluency of a person's speech. So this can sound like a repetition of sounds or an elongation of sounds or a blockage of sounds, meaning no sound, but really it varies widely across people who who stutter. Obviously, a person is not defined by their disorder or disability, and I am not just my stutter. I think that having a stutter has affected and shaped my life experience a bunch, and I really truly think that I would not be the same person without it. I think that stuttering is barely talked about in all media, and I think representation is so important, and that it would be the best for me to share my knowledge and experiences with y'all today. So, first, we're going to have a chat about stigma and myths that surround stuttering. I think that a lot of myths that are about stuttering have to do with its cause. So often people think people stutter because of nervousness or bad parenting or emotional trauma, childhood trauma, when it's really not one single cause. Experts haven't pinpointed a single cause or reason for stuttering. It could have to do with genetics or how our brains work, but currently there is no single cause for stuttering, and there's also no cure. There is just treatment, which mostly takes in the form of speech therapy. I think often people don't think about the difference between association and causation, and I think in all areas it's really important to establish that line. For example, oftentimes in high anxiety environments like presentations at school, I stutter a lot more, but on the other hand, sometimes I'm in a room by myself talking to myself, and I also stutter, and so sometimes I do a lot too, kind of like I am right now. Um, so yeah, um, a lot of people stutter at some point in their lives, but there's obviously a difference between people who have a stutter and people don't have a stutter. They just stutter sometimes when they're nervous, and I think that's part of the big reason why people don't understand much about stuttering, because they don't see it as an actual disorder. Another part of stuttering that people don't talk about is being physically tired and like out of breath when you're talking. I think this mostly applies to people who have blockages in their speech, which is when no sound comes out of your body and air kind of just pours out of your lungs, and your chest tightens because you're trying so hard to talk and make sounds, but you just can't for like whatever reasons, and sometimes during bad episodes, after I'm finished speaking, I am actually sweating. Sometimes when I'm talking to strangers for the first time and they ask me for my name, they often say, "Did you forget your name?" Haha, really funny joke. I totally was running out of air trying to say my name for 10 seconds because I was joking and being silly and funny and forgot my name because it was a joke. Really, really funny joke, by the way. Speaking of jokes, I often get scared to tell jokes or longer stories because I'm always scared of feeling like I am wasting the person's I'm talking to's time, because I'm just talking for a longer time than a person who doesn't have a stutter would. When people say, "Did I stutter?" when kind of people, it's kind of just really degrading to people who stutter, because it's indirectly telling them, "Hey, I can talk eloquently and you can't, and I can express my opinions well and you can't, and since I didn't stutter, my opinions are more valid than yours." And I think it's such a common phrase, which is actually crazy to me because of how ignorant the phrase is and what it implies. I think ableism is so common in today's day and age, and I just think that it's really important to bring more light to it, and maybe we can make this world a better, less hateful place, because there is absolutely no need to say such ignorant things like that. Stuttering, I don't think, is really perceived as a real disorder. After all, everyone does it, but obviously not everyone spends around 10 minutes trying to read a paragraph out loud. About 1% of people stutter, and there's no proved cause or cure, but stuttering absolutely needs to be talked about, and the experiences and thoughts and stories of people who have stutters must be heard. And I'm so grateful that you are listening to my story right now. If you can, please go support and or donate to NSA, the National Stuttering Association, to help out with stuttering research and help a non-profit organization empower people like myself. Thank you so much for tuning in today. I am just getting started, and I have so many interesting topics I have lined up for future episodes that I'm so excited to share with y'all, and I will see you soon. Thank you so much. Bye.